Hi everyone, today let us solve some CPC exam practice questions related to anatomy. If you're preparing for the CPC exam, check out my channel's playlist for all CPC exam topics. I have got comprehensive videos covering everything you need to know. Don't forget to like, subscribe and share with your fellow coders. Let's start. First question. The procedure known as blepharoplasty is performed to Option A. Correct the muscle misalignment caused by strabismus. Option B. Correct vision loss due to glaucoma. Option C. Plastic repair a droopy eyelid. Option D. Repair the lens of the eye caused by cataracts. And the right answer will be option C. Plastic repair a droopy eyelid. The procedure known as blepharoplasty is performed to plastic repair a droopy eyelid. The prefix blepharo means eyelid and blepharoplasty would be performed to repair the skin of the eyelid. Blepharoplasty is commonly performed to correct a droopy eyelid, a condition also known as ptosis. Next question. The external ear contains the Read the options. The right answer for this question is option A. The external ear contains the auricle and external auditory canal leading up to the tympanic membrane. If you don't know the answer, you can find this answer in your ICD manual. In the chapter 8, Diseases of the Ear and Mastoid Process, they have mentioned anatomy of the ear with the diagram. In that you can find the external ear contains auricle, auditory canal leading up to the tympanic membrane. The tympanic membrane separates outer ear canal from the middle and inner ear. Middle ear includes incus, stapes and malleus. The inner ear contains the cochlea, semicircular canals and eustachian tube. This is where sound waves are converted into nerve impulses which are read by the brain. Let us move on to the next question. A dilated enlarged varicose vein that developed inside the rectum and slipped outside of the anus is called a what? Option A. External hemorrhoid. Option B. Internal hemorrhoid. Option C. Prolapsed hemorrhoid. Option D. Varicose hemorrhoid. The right answer is option C. Prolapsed hemorrhoid. A dilated enlarged varicose vein that developed inside the rectum and slipped outside of the anus is called a prolapsed hemorrhoid. An external hemorrhoid is one that occurs on outside of the rectum. Internal hemorrhoid occurs inside the rectum and is still inside the rectum. A prolapsed hemorrhoid has slipped from the inside of the rectum to the outside. Therefore, the right answer is option C. Next question. One of the most common prostatic disorders is which is an enlargement of the prostate gland. This disorder may require a transurethral resection of the prostate. So they're asking which is the most common prostatic disorder which is an enlargement of the prostate gland. The right answer is option B, benign prostatic hyperplasia. One of the most common prostatic disorder. It includes enlargement of the prostate gland. This disorder may require transurethral resection of the prostate, that is TURP. Benign prostatic hyperplasia is caused by excessive growth of prostatic nodules. It can also cause urinary tract infections. Next question. What is the primary function of the lymph nodes? And the right answer is option D, to filter lymph fluid to remove bacteria and viruses. The primary function of lymph node is to filter lymph fluid and to remove bacteria and virus as well as other harmful materials. Lymph nodes function together to filter harmful organisms out of the body, which is a major function of the immune system. Let us move on to the next question. The tibialis anterior muscle controls option A, finger flexure tendons in the wrist. Option B, frontal flexion of the upper abdomen. Option C, frontal flexion of the lower leg. Option D, forehead furrow lines. And the right answer is option C, tibialis anterior muscle controls frontal flexion of the lower leg. The term tibialis refers to the tibia muscle that is located in the lower leg. The term anterior refers to front of the body. If you don't know the answer, you can find the answer in your CPT manual, Surgery Musculoskeletal System, page number 125. There's a diagram representing muscular system front. In that you can find tibialis anterior muscle. So that is in the lower leg. Therefore, you can mark the answer as C. Okay? Let us move on to the next question. What is the difference between meningitis and encephalitis? You can read the options. The right answer is option B. Meningitis is the inflammation of the lining of the brain and encephalitis is the inflammation of the brain. Option A will be wrong because they have mentioned meningitis is inflammation of the spinal cord. But inflammation of the spinal cord is known as myelitis, not meningitis. Option C will be wrong because they have mentioned encephalitis is the swelling of the spinal cord. But encephalitis is inflammation of the brain, not swelling of spinal cord. Option D is wrong because they have mentioned meningitis is a respiratory infection, which is wrong. Therefore, the right answer is option B. Next question. What is an inflammation of the clear front part of the eye? Option A, conjunctivitis. Option B, iritis. Option C, scleritis. Option D, keratitis. And the right answer is option D, keratitis. Keratitis is an inflammation of the cornea, the clear dome-shaped tissue on the front of your eye that covers the pupil and iris. Option A, conjunctivitis, is wrong because that is inflammation of the conjunctiva, the thin clear tissue covering the white part of the eye. And option B, iritis, is wrong because that is the inflammation of the iris. And option C, scleritis, is wrong because that is inflammation of the sclera. According to the question, inflammation of the clear front part of the eye is known as keratitis. Next question. Which of the following is a type of muscle that is found in the heart? Option A, skeletal muscle. Option B, smooth muscle. Option C, cardiac muscle. Option D, striated muscle. And the right answer is option C, cardiac muscle. Cardiac muscles are found only in the heart. These muscles contract to pump blood throughout the body. They work automatically without conscious effort. Next question. Which of the following bones exist bilaterally? Option A, sacrum. Option B, scapula. Option C, sternum. Option D, coccyx. And the right answer is option B, scapula. The bone that exists bilaterally. It means that it is present on both sides of the body. So that is scapula. Scapula is also known as shoulder blade. There are two scapulae, one on each side of the upper back. Option A, sacrum, is wrong because it is a single bone located at the base of the spine. Option C, sternum, will be wrong because it is a single bone located in the center of the chest. Option D, coccyx, will be wrong because it is also known as a tailbone. It is a single bone at the base of the spine. So that's it for today. In the next video, we'll see another important CPC exam topic. So stay tuned.